Hello, my name is Uche Chukwuneze, and I will be doing my presentation on Lyme disease. Here's a quick introduction and background of Lyme disease. Lyme disease is carried by the spirus or bacterium called Borrelia burgdorferi. It is transmitted to humans or animals by the black-legged tick. It is the most commonly reported vector-borne disease in the United States. It is heavily concentrated in the Northeast and Upper Midwest. 96% of all reported cases came from 14 states in those regions in 2014. Here's a map of Lyme disease concentration. As indicated by the CDC from 2001 to 2014, as you can see, the prevalence of the disease has increased and it is highly concentrated in the Northeast and Upper Midwest region of the country. The population at risk are individuals living in woody and tall grass areas, outdoor workers, such as construction workers and agricultural workers, pet owners that allow their pets to go outside, and also individuals conducting outdoor activities such as hiking and hunting. The signs and symptoms of Lyme disease in the acute stage: individuals present with erythema migrans, which is a rash that has a bull's eye appearance. Individuals have generalized fatigue. They have flu-like symptoms, headaches, and swollen lymph nodes. In the early disseminated stages, individuals have fever, pain in joints and tendons, sore throat, severe fatigue. In the later stages, individuals have neurological disorders or arthritis. And here's a map of symptoms of Lyme disease as reported by the CDC, and it shows that erythema migrans is the most commonly reported symptom of Lyme disease. There are about 30,000 cases reported annually to the CDC of Lyme disease. This figure is underrepresented as there are many misdiagnoses of Lyme disease because it can mimic symptoms of other diseases. After research and studies were conducted, the CDC estimated there are about 300,000 cases occurring annually in the United States. And the summer months of June and July present with the most cases. This may be due to individuals are more likely to go outside in the summer months. The diagnosis and treatment: patients are diagnosed based on suspected tick bite and development of symptoms. Diagnosis based solely on symptoms can be misleading, as Lyme disease mimics symptoms of other diseases. Blood testing also helps in diagnosis. Animals can be treated effectively with doxycycline. Patients are treated with antibiotics, and it is more effective if done early. Prevention: individuals need to be mindful of areas where ticks are and walk through scented trails and avoid walking through tall grass when hiking. Individuals need to wear protective clothing and spray DEET on skin or clothes. They need to be mindful of animals that have ticks. Also, pets need to be taken care of properly and groomed. Also, they need to see the veterinarians periodically. Individuals should take a shower soon after outdoor activities and inspect ticks all over the body. They need to follow proper tick removal on the body and use tweezers as close to the skin as possible and pull straight up to remove the ticks. Individuals should never try to crush the ticks with their hands. It is not advisable. Ticks lasting on the skin for 36 to 48 hours are more likely to transmit Lyme disease. Individuals can also spray their clothes with 0.5% permethrin to prevent ticks. In conclusion, individuals residing in heavily concentrated areas of Lyme disease need to be mindful of their environment and follow proper prevention techniques. Outdoor workers should be educated on Lyme disease and receive protection equipment, and also get proper training on tick removal. Individuals should regularly check for ticks on their bodies and also their pets, and follow removal technique if need be. Appropriate techniques need to be developed to reduce the misdiagnosis of Lyme disease. Also, the government should Also, the government should provide funding for prevention strategies and also research to help in the development of vaccines. Thank you very much. Have a nice day.